Good afternoon, everybody. Thanks for joining us. I want to begin, as we always do, by acknowledging we're on Treaty 1 territory in the traditional homeland of the Métis. I'm joined by Jay Shaw, Assistant Chief Emergency Management, and provide a brief update on COVID-related matters. We'll both be available to answer your questions on that, and then I'll remain afterwards for topics on other discussions that members of the media may have for me. I want to acknowledge some of the recent numbers that we're hearing about from provincial officials. 23 new cases reported today in the city of Winnipeg, 31,590 cases to date in the province of Manitoba. Regrettably, one new death of one of our residents in the city of Winnipeg, 207 in the hospital with 29 in intensive care units. 266 cases in Winnipeg over the last 7 days with a test positivity rate of 4%. We're not through the COVID storm yet. I want to just remind all Winnipeggers to continue to be vigilant and continue to wash hands, wear a mask, and watch your distance. Today, I'm very pleased to see the city is in a position to recall approximately 75 temporary part-time employees who were previously laid off. This is as a result of the city reopening a number of recreation and leisure facilities on March 8th, which Jay will be able to provide you with additional details on in a few moments. There are a number of measures that will form part of this reopening as a result of the provincial public health orders. Pools and arenas will remain closed until further notice. Effective March 1st, all Winnipeg Public Library branches will be open for contactless holds and pickups and returns only, with the exception of the Cornish Library, which, as you know, will remain closed for renovations. I'd like to just say I know there are many in our community, myself included and my family included, who are anxiously awaiting the reopening of more city facilities. However, the city is taking a measured approach that's prioritizing safety as we continue to look at ways we can safely reopen other facilities under the provincial public health orders. With that, I'll turn it over to Jay, and again, we'll be available to answer your questions.
Thank you, Mr. Mayor. Good afternoon. My name is Jay Shaw. I'm the Assistant Chief of Emergency Management for the City of Winnipeg. Today, I'm pleased to announce that the City of Winnipeg is reopening 9 recreation and leisure facilities and recalling approximately 75 temporary part-time employees who were previously laid off to support the reopening of these facilities. Beginning Monday, March 8th, the following city-owned and operated fitness centers will reopen for limited fitness services only: Chief Peguis Fitness Center, Cindy Clausen Recreation Complex, Elmwood Kildonan Pool, Fort Rouge Leisure Center, Freight House Recreation Center, Kinsman Sherbrooke Pool, Pan Am Pool, Sergeant Tommy Prince Place, St. James Assiniboine Centennial Pool. City-owned and operated pools and arenas remain closed until further notice. Residents are encouraged to book fitness blocks prior to arriving at these facilities, as there is no guarantee of available blocks for registration upon arrival due to capacity restrictions. The blocks will be offered on a week-by-week basis, and reservations can be made up to 30 minutes in advance of the pre-reserved time, space permitting. Every Thursday, another week of fitness blocks will be added to what's available for registration. No group activities will be available at this time. Capacity at these facilities is limited to ensure physical distancing, and those guidelines and provincial public health orders are maintained. Fitness areas will be closed to the public for 30 minutes between the 2-hour block to sanitize and allow for reasonable time for public to vacate the facility prior to the next scheduled block. We are also asking that you please come dressed to use the fitness amenities. As per the provincial public health orders, the change rooms will not be open. Under current provincial public health orders, we are required to collect contact information from visitors when entering our recreation and leisure facilities. To make this process safer and more convenient, we will be using a QR code-based system. Upon entering our recreation and leisure facilities, visitors must scan or use the QR code using their smartphone and enter their name and phone number in the digital form. For those without a smartphone, front desk staff will be able to manually input their information in the form. Only one member of each household is required to enter their contact information. The data will be stored on a secured network for 21 days and only accessed if required by a public health investigation in consultation with our privacy officer. In the event of a potential exposure that occurs, individuals may be notified by Manitoba Health's contact tracing personnel. I want to once again take this opportunity to thank our residents for their continued patience as we work through these evolving processes. We can now take your questions.
Jeff from CTV.
No, I don't have anything.
Okay, thank you. James from The Sun.
Yeah, good afternoon. Mr. Mayor, I'm just wondering if you've had any updates from the province regarding vaccine deployment, potentially for frontline workers here in the city.
Not recently. We continue to advocate on behalf of our employees, especially those that are providing essential services, first responders. As you know, the provincial vaccine plans do not appear to have prioritized members of the Winnipeg Police Service, for example. There are others that are providing essential services like transit operators in addition to paramedics and firefighters. And we continue to advocate on their behalf and really on behalf of Winnipeggers who are relying on these services. What we don't want to see is the services that are provided to Winnipeggers that they rely upon, especially in areas of first responders, being compromised. And so we have and will continue to advocate on their behalf.
Thank you.
Joyanne from the Free Press.
Hi, so for the fitness centers, does this mean, it reads to me like you're only opening the fitness sections in the 9 facilities listed, but not the pools in any of them? Even though some of them are called pools, it's such a key element of what they offer.
Yeah, that's correct, Joanne. What we're doing right now is we're taking a slow and measured approach. So we're starting with the recreation facilities as we work through the processes and work with the province on the public health orders in order to get everything open. So safe, slow approach, starting with the gyms and the recreation centers. And I look forward to hopefully making more announcements when we're available to get everything else open.
I'll just add to that, Joyanne. I mean, as you know, when the provincial public health orders are announced through their press conferences, we are often learning in real time along with you, and then we do wait for the provincial health orders to be publicly released, typically days following. And then the dialogue really begins between our public services to ensure that the openings, like the ones we're announcing today, are being done that comply with the letter and spirit of the provincial public health orders. We're also carefully watching the disclosures by the province on these new variants, and so mindful that the provincial public health orders are evolving and changing. But in the meantime, I'm grateful for the fact that our public service is in dialogue with their provincial counterparts, and the sooner we can open additional facilities, the better.
And so why at this point are pools not able to be open? Is that linked to swimmers not wearing masks? Is there a specific risk with pools?
No, there's no specific risk with pools or chlorinated water or any of those types of things that were discussed before in the spring reopenings. But where we're at right now is we have to take a measured and slow approach, and we have to work through some of the processes to be able to get to that 25%. So we're starting with recreation, and we're working on the plans to open everything else up.
Sorry, so just to clarify that last comment, why would pools be never at the forefront? I mean, this is the second round of reopenings, and it always tends to be sort of among the last things. I would imagine there is a reason for that.
I would just go back to talk about, in the springtime when we open things up, the restrictions were a little bit different in terms of how and when and what that looks like. We were more talking about opening outdoor pools at that time and working through those processes. So now we're working through the processes to make sure that we can effectively open at 25% and follow the rules with one-on-one and those types of processes that the province has laid out to keep people safe. So I'm not saying we're not opening the pools, We are going to open them eventually. We're just got to go through the processes to make everything safe. We're starting with the recreation centers.
Sean from CBC.
You have to, because there's such a rigor with keeping everything clean, do you have to add staff, or are you doing it under existing deployment rates?
Yeah, great question. So part of the challenge is identifying through our occupational health and safety processes, how we're going to bring people in, how we're going to, usher them through the building and to keep them safe and keep that 6 feet of separation and work through all that. So there is some requirements for new training for some of the staff to be able to, sort of become liaison folks to be able to assess with those safety measures. So you're correct. As we recall and bring these staff in, there's more training and there's more awareness in terms of making sure that we can serve our residents better and make sure that they're staying safe in these facilities. So that takes a bit of time.
Okay.
James from the Sun, just double checking. Did you have any final COVID questions?
No.
You're good. Joyanne, did you have any further COVID questions?
I have a few, so bear with me if you could. Aren't some of the fitness facilities that would be offered here, though, quite small? Because they pretty much are, their pool is their main attraction, and why open them, I guess, without opening the pools?
Number one reason, our residents want them open, and we want to be able to provide services throughout the whole city. So if we can, we're going to do it. You are correct. Some of the gyms are smaller. So again, that's why we can't have a one-size-fit-all plan for every single facility. Some hallways are smaller, some, access to be able to get into the facility. So it took a bit of time to go through and work with our occupational health and safety staff to be able to make sure that all those processes were done. And again, we want to be able to open facilities throughout for all residents in every section of the city. So we are going to do our best to get them all open for the 8th.
I'll speak as someone who grew up at the Pan Am pool. I mean, you go into those change rooms, there's some pretty narrow hallways. And so I appreciate the fact that the staff are, obviously, there are rules and processes being put in place in terms of the need to change at your home and come in and get to your workout. But that's a good example if you've been in that facility, Joyanne, as I'm sure you and others on this call have been. It's an illustration where the physical infrastructure poses some challenges that are being resolved by our staff, for which we really appreciate.
Or are you saying that's one of the pool issues? Like that's right around the pool area would be narrow hallways at Pan Am?
I don't know if it's specifically at that location in terms of narrow hallways. That's just an example of some of the work that has to go through, Joyanne, with all the assessments in terms of making sure we can maintain 25% capacity and do all those things that we need to do to maintain safety for the public health orders. So it's good that we're getting these open, and I if we can take a slow and measured approach and the province looks to open things up a little bit more, it's going to make things easier, but we have to follow the public health orders.
And when will the pools then open?
I don't have a date for you at this time.
Okay. Are all the employees called back now with these 75 coming back?
No, I think we have 300 or so that are still temporarily laid off.
Okay. And for the, there was a part of the press release that talks about these facilities being available as a warming option. How exactly would that work?
Yeah, so right now at St. Boniface and Millennium Library, at the front vestibule entrances, just as you go through sort of the double doors, we have warming spaces there where you can come in out of the cold if required. All of these other facilities will act in the same matter for now, at least for the next week or so as we try and get out of this cold spell. It's going to get cold again soon, so I would ask everyone to make sure they're aware of the weather forecasts, and we're not out of winter yet, so we want to still provide those services for the next few weeks, and hopefully we get some warm temperatures coming soon. But that's the intent, is to be able to use those facilities throughout the city. It's not just the downtown. It can be cold everywhere in Winnipeg, so we want to make sure that our residents have a spot to go if needed. So. Just an added feature.
Is that considered a warming center, or what is that considered? I didn't know how to.
Yeah, we're calling
that
them
would
warming
be.
spaces. There's limited services. Basically, before the pandemic, if you recall, anytime we had extreme weather, we would allow folks and tell folks, hey, come in out of the cold, take an opportunity to warm up, and make sure that you're set up and able to go back out on your journey. If you need to take a quick 10, 15-minute break and respite from the cold and the wind, then come on in and do that. Unfortunately, with the pandemic and services being closed, as we open up more services, we want to be able to do that where we can.
Okay, so this is sort of returning to allow very short breaks that we did at these same facilities in the past.
Yeah, before the pandemic, for sure.
Okay. Okay, so this isn't really the warming center option that the mayor was talking about being potential if the province provided staff. This is something very minimal and more like what we've done before.
Yep.
Yeah, that's correct, Joanne.
Okay, thank you.
Are you good, Joanne?
I am good on the COVID unless, you know what, I'll try one more time, just with the pools, if there's any specifics at all we can say on why we can't open them and why they always tend to come last.
Yeah, I think I've tried to cover it. I'm doing my best to get them open as fast as possible, so I will, I'll do my best at the next presser to hopefully give you some better news, but we're gonna get the recreation centers open first and do that, and I hope to have announcements on the pools as soon as possible. I don't have a date for you, though.
Joanne,
Sorry.
in the discussions we've had, we're complying with provincial public health orders. Our need, in some cases, to have dialogue with provincial officials and for our staff to make sure that the policies and processes that are in place when those facilities open protect the safety of our staff and our residents. And that work is ongoing with respect to pools and other recreation facilities. And so today is part of that phased reopening, and hopefully we'll be able to be in a position to open them sooner than later. I can tell you just personally, I'm really looking forward to the pools being open myself as someone whose family and I use them. So I'm quite anxious for them to open, but we obviously need to make sure that that we're following some of the due diligence steps that I've outlined.
Sean from CBC, did you have any final COVID questions?
No, I don't.
You're good? Okay. I think I will triple check. Joanne, are you okay now?
I guess one last thing, if there's any examples of what you actually can do with these rec facilities. I know it's super limited, no group classes, so what can you do, like run on a treadmill? Like, what are the options?
Yeah, so every fitness facility has a sort of a different genre of equipment that they have, and your regular free weights and machines and treadmills and elliptical trainers and all of those, and they're pretty close to all the same throughout the whole city, but there are the odd differences, and a lot of it's based on the size of the facility. So your regular gym equipment that you would go for fitness activities is what's going to be open.
Okay, thank you.
Thank you. Okay, we will let Jay go, and then we will switch. We'll switch over. So give us 1 second.
I tried. Thanks very much. We're good? Okay. I'll just have a few opening remarks, and then I know there's a number of questions on a few issues that some of you have questions on, so I'll obviously be available to answer questions on other topics as well. I want to let you know, at our most recent council meeting, there was a unanimous vote, if my memory is correct, for council to have a say on the implementation of electronic voting for council meetings. I've worked with my council colleague, Councillor Rollins, and we'll be introducing a motion that'll be introduced tomorrow at the council meeting. It'll be a notice of motion, so it will then be considered by council at the following council meeting. And it relates to the implementation of e-voting. Essentially, it asks for the city clerks to conduct an information session for all members of council so they can get better informed about how the electronic voting has been utilized by Executive Policy Committee since September. It also asks the public service to provide an administrative report that would be considered at a later date by council. So wanted to just let you know that that will be introduced tomorrow. I'd also like to offer some opening remarks on a number of issues that have played out through the media in recent days and weeks. First, with regards to a statement issued this morning by Alex Forrest, president of the UFFW, which requests the release of, from what we understand, a specific part of the recent investigation into allegations of racism. As I've previously indicated publicly, I do support the release of as much information related to this matter as possible at the appropriate time. What Mr. Forrest is requesting, however, involves addressing legal and privacy protections afforded to his members, the patient, as well as other city unions and employees. An appropriate starting point for Mr. Forrest would be by providing the written legal consents of his members to release all of their information relating to this matter. Until that time, however, there is a confidential hearing process that's underway, which is set out in the collective bargaining agreement, and I would encourage Mr. Forrest to respect the process of the collective bargaining agreement. Secondly, I'd like to address a recent request I've made to three unions that are represented in the Winnipeg Fire and Paramedic Service. Since 2015, I've worked really hard with my council colleagues to combat racism through a number of measures, many of which have been reported by many of you on this call today. As you know, in 2015, I hosted the Mayor's National Summit on Racial Inclusion. We created the Mayor's Indigenous Advisory Circle. We had a year of reconciliation. We have implemented, at the direction of council, reconciliation training for all City of Winnipeg employees, and that was really targeting better education on the impact of Indian residential schools system. We have initiated the Winnipeg Indigenous Accord back in 2017, and there's ongoing work with respect to that. There is the new Welcoming Winnipeg policy and efforts, which I know many of you have reported on. We've established, from what we understand, the first human rights committee of a council and of any major city in Canada. That has led to the creation of the Welcome and Newcomer Inclusion Policy, which, among other things, brings forward actions including efforts to create a city without racism and a policy strategic framework which identifies goals that'll be phased in. We've also have now a diversity coordinator for the City of Winnipeg, and in the coming weeks, training will begin on anti-oppression, including cultural competency training for all members of the public service, as well as all members of council, including myself. I continue to believe it's important for all leaders in our community to acknowledge that systemic racism exists and to take action to address it within their areas of leadership. Recently, I requested all union leaders acknowledge the existence of systemic racism within their membership and within their respective departments to communicate what actions they've taken to address it. Two of the three union leaders in the Winnipeg Fire and Paramedic Service, Mr. Forrest and Ms. Goronsky, have yet to publicly acknowledge the existence of systemic racism within their departments and their membership. The leader of the Winnipeg Fire Paramedic Senior Officers Association, Mr. Rollwagon, is one that has shown leadership to acknowledge it and commit to redoubling their efforts to combat racism in all of its forms, and I want to thank them for that. Yesterday, I sent a request to the leaders of these three unions, which offered to bring the parties together along with Chief Lane and myself to have an open and candid dialogue to work to better address the issues within the Winnipeg Fire Paramedic Service and the unions that represent the valued employees of this department. I understand that this request has been distributed to some members of the media. Only one of the leaders has to date accepted my offer to meet, and I hope to see Mr. Forrest and Ms. Goronsky commit to a meeting very soon. I'll be candid and let's be frank. The two largest unions at the center of this, UFFW and MGU, don't always get along, and they haven't for many, many years. And I'll say this, when they can't even acknowledge the existence of systemic racism, one has to ask why not. And when an invite to meet and have really direct collaborative dialogue turns into attacks through the media, it provides a very stark illustration of what civic leaders are dealing with. I'll continue to do my best to bring leaders together, to lead council and to work hard to combat racism in all of its forms. And with that, I'll be available to answer your questions on those or other topics that you might have.
Hi, we'll go with open scrum format, so just ask away.
Mr. Mayor, it's James from the Sun here.
Hey, James.
Yeah, about the statement, the UFFW suggests that this incident is not really about racism. It's about enmity between these two unions. Can you address that, please?
Well, there is a confidential hearing that is underway right now. This is after an independent investigation and review of this specific incident was conducted. Obviously, I want to see appropriate disciplinary measures enacted, but of course that's subject to the process that's been bargained with the union that we're following. You know, he is acknowledging certainly what we've heard from union leaders for many years, that they don't always get along. That being said, the issues of systemic racism are serious, and they do really warrant ongoing and renewed efforts by civic leaders. And so what I'm trying to do is, you know, obviously we've acknowledged our CAO, our Fire and Paramedic Service Chief, and I have acknowledged systemic racism within our municipal government and within the Winnipeg Fire and Paramedic Service. We look to civic leaders in our unions to make that acknowledgement and really redouble their efforts to work with us to combat racism in all of its form. But I will say that there's obviously the confidential hearing process that's ongoing. There's also the ongoing efforts to deal with systemic racism. Some of the issues within the Winnipeg Fire and Paramedic Service, though, that relate to just the workplace culture are connected to issues of racism and allegations of racism. And so I really think it's incumbent upon everybody to really redouble their efforts and try to work together, and I'm trying to facilitate that.
Just as a follow-up, please. It seems like this strained relationship between these two unions is impacting patient care. So what's it going to take for this long-standing feud to be laid to rest? You know, hopefully, you know, we don't see a Winnipegger dying because of this.
Well, I mean, there's a couple things. There is a tremendous amount of stress about the future of the service. That's been the elephant in the room for many years. We've been looking for direction from the provincial government on what they would like to do with ambulance services, which is in their areas of jurisdiction. Let's also be clear, regardless of who provides the service, the issues of systemic racism still need to be addressed. And so within the framework that is imposed upon us by the provincial government, we're doing our best to help combat those issues. And I know there have been steps by our public servants from a management perspective to help deal with some of the more systemic issues, racism, but also just the culture within the Winnipeg Fire and Paramedic Service. And I'm sure our chief and our public service could provide you with additional information about some of the measures that they've been working on over the last number of years. What I'm trying to do, though, I mean, the anti-oppression, the cultural competency work is incredibly important, not just within this department, but citywide. And in the meantime, I'm trying to facilitate open and candid dialogue from these particular union leaders as well as our chief to see how folks can work together more effectively. And I'm hopeful that they will accept the invitation to meet, and I can help facilitate that dialogue.
Thank you.
Sorry, if I could just jump
Hey,
in,
Jeff.
Mr. Mayor. So based on everything you just said, or some of it, the answer to the request or demand, I guess, from the UFFW for the video would be a no.
Well, a starting place for Mr. Forrest would be to provide the written consents of his members for the release of all of their information pertaining to this matter. That would be a starting place. I've publicly acknowledged I'd like to see as much information made publicly available as possible, but let's keep in mind from the video that he's referencing. I'm not a direct participant in this confidential hearing that's going on right now, so I haven't seen this video. But if such a video exists, I would simply say, there is legal and privacy protections afforded to the patient involved, as well as the employees of various unions that would be involved. And so a starting place for Mr. Forrest, if he's making this request, would be to provide the written legal consents of his members for the release of all of the information pertaining to those members with respect to this matter.
Mr. Mayor, you said if such a video exists, you've read the independent consultant's investigation, correct?
I have seen it shared through the media. Yes, I have. And you're right, Sean.
You haven't read that? Wait, you haven't read that? You haven't read that report?
No, I've read.
Why would you not read that report? I'm very curious to know why you wouldn't read that report.
So, Sean, I have read the report that's been released through the media.
Okay, so then
I
you would
have.
understand that.
Sean, could I
such a
just answer
video
the question,
exists.
if you don't mind?
Yeah, go ahead.
Okay, thanks. Sorry, and then you can come back with additional follow-up if you don't mind. But so I have read the report that's been released. You are correct to point out it references the video. What I'm simply stating is I haven't seen the video that Mr. Forrest is referencing today.
Sorry, that caught me off guard.
Yeah, no, and I should have phrased it that way. My apologies.
So with respect to the video, maybe I'll follow up on Jeff's question.
Sure.
If the privacy concerns, and I'm going to assume that there's a FIA issue there as well as privacy with respect to employees, if all of these were worked through specific to the video, you would support releasing it to answer any unanswered questions the public might have about that incident. Is that fair?
I'd like to see as much information pertaining to this matter publicly released as can be legally made available to the public. Mr. Forrest has made the request today for this particular aspect of this matter, and I would simply say in response to that where he should start is providing the written legal consents of his members for the release of all of the information pertaining to this matter with respect to his members. That would be a starting place. But you're right to point out, and I am pointing that out as well, is there are protections provided to the patient is involved, as well as other city employees and union members from other unions. So the starting place, he's made the request, the starting place would be provide the written legal consents for the disclosure of all information pertaining to his members with respect to this matter.
Follow up on James's question. You're essentially, by implying that the province really has much of the control of the ambulance paramedic service, that the city is, I hate to use the word stuck with the model under which it provides emergency services. Is that fair?
I think
obvious
I think
problems.
I think largely, Sean, yes. Couple things. I mean, the reason I mentioned that is, I think it's important to acknowledge there has been, and I've heard it from employees, I've heard it from the unions. There is a tremendous amount of uncertainty right now in the Winnipeg Fire and Paramedic Service because of the lack of decision making from the provincial government. I don't want to use that statement to somehow deny the responsibility for civic leaders to combat racism and properly investigate and provide discipline as circumstances warrant, and that is occurring. Even if the service is fundamentally changed, however, the issues of systemic racism still need to be addressed. So, you know, what I'm trying to do with the model that we do have, that we are currently operating in, is try to do our best to combat it. And I'm trying to bring people together to be more effective at it. But what I was, you know, that was in response to just talking about the overall culture and dynamic in the paramedic service. That is a stress right now that members have shared with me, is looking for that certainty. I know I've advocated for that certainty and direction from the province for some time.
Hi, sir.
Go ahead.
Sorry.
Yeah, if I could just get a clarification, Mr. Mayor, on something.
Sure.
So you're inviting the unions and I guess yourself to get together.
Yeah.
Is it to talk about, you know, why paramedics and firefighters, not all, but some don't get along?
Yeah.
And some of those workplace, I guess, disagreements, or is it more to do with how do we tackle systemic racism? What is it you want to accomplish? Like, what is the point of that invite?
So yeah, the invite went out yesterday to Chief Lane, and the three union leaders of the respective unions that I've mentioned, the Winnipeg Fire Paramedic Senior Officers Association, who has confirmed and accepted a willingness to meet with everybody, as well as MGU and UFFW. The first thing is just to have an open and candid discussion about issues of systemic racism, as well as the overall relationship of these respective unions and civic leaders. And so the issues are connected. There's no way to deny that the issues of racism and systemic racism are negatively affecting the relationships of members of the Winnipeg Fire and Paramedic Service. And so, I sent that request directly to the members, and since they've obviously released it to the media, which is fine. That the approach was really just to have a discussion with them to see how we could more effectively work together, and they may or may not accept that invitation. I'm hopeful that they will. I will then, as well as I'm doing today and I've done previously, ask that they acknowledge systemic racism exists within the service, but within their unions, and redouble our efforts to work collaboratively together to combat it.
So, but when you say work better together, are you talking about firefighters and paramedics?
I think there's a role so the answer is yes, Jeff, but also I think there's a role for all civic leaders within that particular department to work more effectively together. And that's why I've invited Chief Lane as well as the three unions. I think there's a role for everybody to be more effective by working together. But it does illustrate what we're dealing with when two of the union leaders still have yet to publicly acknowledge systemic racism in the department and within their membership. And secondly, take an invitation to meet, to have an open and candid discussion, that becomes, a media attack. And so, not by you, but it's taken to the media, and there's obviously they've reacted the way in which some of you have already reported, and it is illustrative of what we're dealing with.
Can you further elicit or say systemic racism is connected to tension between the unions? Are you thinking of specific instances in mind that have been brought to your attention, or just what you've heard, or it's been implied to you? How do you make that link, and can you provide examples of it.
Yeah, I mean, firstly, I mean, anytime there's systemic racism, which I've acknowledged exists throughout all levels of government, that does not position you well to have as healthy a work environment for everybody involved. And I think everybody suffers from systemic racism in all of its forms throughout our society, but also within this particular department. The specific investigation that is now a subject of the hearing, I think serves as an illustration of where issues of racism were alleged and investigated by the city of Winnipeg. So that would be an example. And I don't think that that's helpful to having the respectful work environment that members of the city's public service deserve.
In the statement that the United Firefighters of Winnipeg released last night calling for the video to be released, they say that they have aggressively supported diversity and inclusiveness issues, say that the incident in question that was investigated is not an issue of racism, and they say that it doesn't represent a long-standing commitment to fight intolerance and promote diversity. That is not enough of a statement as far as you're concerned about systemic racism in the Fire Paramedic Service, correct?
So I appreciate the efforts of any of our civic leaders to help combat racism. And so, but you're right, Sean. I mean, I have asked Alex Forrest in particular to acknowledge that systemic racism exists within the department and his union, and he's refused to do so to date. I also recall over a week ago this particular union leader saying he wasn't going to be speaking about this matter again, and yet here we are. You know, this matter is being dealt with in a hearing as we speak, and that's where it should be dealt with.
Okay.
Anybody
else have-
I was
Go
going to
ahead.
move on to another, if that's okay.
Sure.
So there is some changes at the Bay building now. I guess it's been boarded up. It definitely looks different than it did prior to now. I guess what are your thoughts on that? Are you concerned about the look of downtown with this massive building now boarded up and right at that key spot?
Yeah, it's obviously not the best look for that building or for that area of our city. I have had dialogue through our office today with the committee that we've established. Keep in mind, this is a building that is owned by a third party, and you know, we'll have dialogue with them. The reason this committee that I announced previously was established was to have dialogue with HBC on what their plans were to dispose of this particular asset, and to see how we could work collaboratively with them, and we'll continue to do that through this committee, and including on this issue of the boards going up right now. It's obviously it's not a good look.
And I guess with that appearance, what's the effect on downtown? Because it really covers a whole city block. It's a very unique building and how massive it is, right?
Well, during the pandemic, I mean, of course, downtown, you know, like all downtowns throughout Canada, you know, has certainly, you know, been negatively affected by the pandemic, and the fact that there are less people frequenting areas of our city that they would normally be visiting. And so, you know, what I would say is with, you know, when you look at downtown, though, we have more people living in downtown than ever in the history of our city. We still have investments being made and new construction and cranes in our downtown. And so the long-term future of our downtown continues to grow stronger. We have, of course, the tallest building being erected right now, the Artists Tower. It's the tallest building, I think, between Toronto and Calgary, and it's residential driven. We've got True North Square, of course, but also other investments like Red River College, the Richardson Innovation Center, and many others. And so, you know, I think Winnipeggers need to keep in mind that our downtown is continuing to grow stronger, but this particular building is a pretty substantive asset in our downtown, and it's which is why I've tried to bring community leaders together to try to help with that dialogue with HBC while they currently still own the building.
Okay, and I guess, do you think anything can be, do you want to see something done to this, to make it more inviting? I guess right now it's a bunch of boards, but
Yeah.
could you do something to display there to make it look less, or less? Yeah.
Yeah, I think short answer is yes, Joyanne. I'm you know, we want to have some dialogue with HBC, and then you know, they or we can let you know what the results are of that discussion. So I haven't had any direct discussions with them yet, but we do have this committee, and we've asked that they have some dialogue and consider it. So the short answer is yeah. I think we can do better. It's not the best look for that that part of our city.
Do you have any timelines? We've been talking about the Bay Building and its future
Yeah.
since for more than a decade, and now it's boarded up. A year of boarded up acceptable? 18 months? 2 years? 5 years? What do you think?
Well, I did set a timeline when if you revisit the release that we put out, Sean, when we announced this HBC committee, there was a timeline to hear back from them, and so I believe it was 6 months, and so that is the timeline for this phase, and I expect there'll be additional dialogue after that one, depending on what we hear back from them. If you or CBC have the dollars involved to do something transformative, please talk to HBC and the committee sooner than later. Are you guys good otherwise?
Yep.
Okay.
Yes.
Some pretty big topics. Thanks very much for your questions today, and I'll see you guys soon. Thanks.